Welcome to Health and Wellness. I'm Dr. Jennifer Ashton. Because February is Heart Awareness Month, today we're going to talk about one's road back to recovery after a major cardiac trauma. So joining us are two special guests, Dr. Mark Wallach, who's Chief of Surgery at Metropolitan Hospital, and his beautiful wife, network news anchor Jamie Colby, who are here to talk about their new book, which is so important from a medical and personal perspective, Back to Life After a Heart Crisis. Mark, in this book, you shared a very personal medical crisis, your brush with death actually, with your own history of cardiac disease and how you eventually wound up having surgery. Tell us a little bit about that.
I was training for the New York Marathon in 2002, and each day, it's 7 minutes into a run, I got chest pain, and I thought it was reflux or agita.
You knew the signs in one part of your brain could be those of a heart attack, but on the emotional side, there's always, for any patient, the very powerful issue of denial. When you were sitting on the other side of the desk from your cardiologist and found out you needed to go for surgery, what went through your head?
Well, first of all, it was like somebody cutting my legs off. It was like my heart dropped literally into my pelvis. And I said to myself, I'm not going to be me anymore. And then I called Jamie. And luckily, I had the lifesaver, which was Jamie Colby.
I ran into a cab. I said, here's $50. You got 5 minutes to get me downtown. Mark was in the office of his cardiologist, and he had only made it 2 minutes on the stress test. But he had had normal stress tests every 6 months for years.
6 months before I had a stress test, I had already run the New York Marathon the November before for September the 11th, and I thought that it wasn't going to happen to me, even though I have a strong family history.
And when someone tells a patient they have coronary artery disease, there are multiple paths that the workup process as well as the treatment process can take. What do you think, now having been through it, is most important for patients to know?
The first thing I tell everyone is you need a second opinion or a third opinion.
Absolutely.
Because the first opinion is not always the correct opinion. It may be.
If it happens to you or someone you love, this is the book that you need because it tells you everything that can happen. Mark had career issues. Mark had depression. Mark couldn't tell the difference, and we learned between medicating physical pain and emotional pain. Right. If it can happen to a chief of surgery and a network news journalist who couldn't find a single thing on the shelf or on the internet about what caregivers are supposed to do, and because I worked at the TV Food Network, I can help you make sure your loved one eats again. Mark lost 30 pounds after his procedure. Can you imagine?
Amazing.
30 pounds less.
Right, so picture me now 30 pounds less than, I was essentially a walking skeleton, and I felt my self-esteem was completely removed.
He went from my rock, he says, to the family project, because helping a loved one recover from any serious medical diagnosis, and this book is written through our story with a heart issue, but really cancer patients and any medical diagnosis, you need to know how to reclaim your life fully, spiritually, emotionally, professionally, and physically.
What was the hardest part for you emotionally?
Finding the answers that I needed. You mentioned about the doctor, some of the tips. I went the night before Mark's procedure, a serious procedure where I knew that I could lose him. I went to the cardiac care intensive care unit, and I recommend to family members, go on a field trip. And I saw a man who was 4 times the size of Mark, who had a quadruple bypass in his 30s, and he looked terrible after the procedure. So when they wheeled out my marathon husband who had this serious procedure, I could honestly say in front of our children and reassure them and him, you look pretty good, because I had been there the day before. Right. If your doctor doesn't give you their email or cell phone after the surgery, because you may have a chest pain or it might be indigestion and you want to make that call, get another doctor.
Right.
And so I give you the tips you need to know that you're in the right hands, you've made the right decision. There's a lot of science in the book, but we don't give it to you in a clinical fashion.
Right.
It's really a love story.
It really
that talks about how to recover from any medical crisis together.
Now, I want to ask you about 2 topics in the book that are a little more difficult for people to discuss. One is, you just hit on it or alluded to it a little bit, the dependence on pain medications. When did you notice, first I'm going to ask Mark, then Jamie, that it had crossed the line and that maybe what you were taking for pain in terms of narcotics was too much?
I didn't notice it. I didn't notice it because I was taking it because emotionally I was a train wreck. And on top of that, you know, the medication first was for the sternotomy, for the breastbone being cut, and it was hurting. And then, as this went on for a week, it made me feel better emotionally.
You know, a little pain reminds you you're alive.
Right.
And you can be alive but not be living. And Mark, I knew, wanted a full life. He wanted to feel and experience so much more. He wanted what he calls his chapter 2. And the only way to get it was to get off the medication, get off the couch, get outside, learn to sleep again. Because he was, you know, any patient that closes their eyes wonders if they'll open again.
That was a very big problem.
It's a big fear. So we address it and give you tips that Mark still practices to this day.
Now let's get to difficult issue number 2.
You saved this for last, Jen.
Well, you know, the best for last in a lot of ways.
I know where she's going.
I know too.
Now, again, as doctors, we know that sex is a very important part of a healthy life, and sexual dysfunction can accompany any major physical or psychological trauma. Tell us, if you will, share a little bit about your road to sexual recovery, because that is so important for patients with heart disease.
For a good period of time after the surgery, I did not feel like a man, quote unquote. And I'm sure a woman who has open heart surgery does not feel like a woman. And so as a result, because of her patience, etc., I was able to try to reconstruct my life. And part of reconstructing my life is reconstructing my own sexuality.
We do know now, we didn't know then, that the science is behind the fact that if you have sex in your life, you will have less of a risk of heart disease in general, but you will also have less of a risk of heart attack in the future. And if you have someone, if you're lucky enough to have a caregiver who's been there through the long road of recovery, that you probably do want to reconnect sexually.
Now, was it scary for you, Jamie?
Of course. Of course it's scary.
But she did a really wonderful thing, as you see in the book, and you read in the book, which is she put her head on my chest and she said, "My God, I've never heard your heart beat as strong as it's beating now."
I was really amazed.
And that blew me away.
All these years, we're married
True
almost
or not
20
true,
years.
blew me away.
I had never realized that his heart could beat so loud, but when I could put my head on his chest and I heard this loud thumping, I realize now I didn't hear it before because he was 95% blocked in 4 arteries. And I said,
With
"Your
no
heart is
collaterals."
beating so strong." He said that was a turning point. He knew that he could make it. He knew that we could reconnect. And actually, he got the nickname Rambo, which we still
love it.
call
I
him
love it
today.
too.
You even have something on pet therapy in here,
So important.
which I think is amazing. And it's your little Yorkie, right?
You know that people live longer and happier lives if they have pets. There's science behind that.
Right.
But Maddie doesn't know the science. She's our 4-pound, 3.5-pound teacup Yorkie. Mark keeps her on a strict diet because he wants her around forever. And Maddie went up on the couch and laid across Mark's chest on his incision. She had never done that before. And she stayed there. It became her job to watch out for him.
I think that is an important thing in here that people really don't oftentimes think of. They're very quick to wait for the prescription, and doctors have promoted that, but you don't think about using everything at your disposal.
Whether you've had an event in your life medically or not, we can't say enough about the patient taking care of themselves, being informed before they become a patient, and also giving support to the caregiver who's often so forgotten, who has to find the answers. I had to really grow up. This is the most adult thing that I've ever been through, and I had to find a way to get him back to his Rambo-esque
Well,
being.
you've done it. You've both done it. It's such an incredible job. And you know, the American Heart Association actually estimates that 90% of the U.S. adult population is actually at risk for coronary heart disease. So I really can't think of a person for whom this book wouldn't be relevant. And again, as the wife of a cardiothoracic surgeon, the daughter of a cardiologist, I can tell you that it is an amazing love story, but it's also amazing information for anyone who either themselves or their family members are facing a cardiac trauma. And I think that you've both done an incredible service. I think this is a must read. And for more information on heart disease and how you can prevent it and find good treatment, go to the American Heart Association website at AmericanHeartAssociation.com. And I want to again thank Dr. Mark Wallach and Jamie Colby for joining us today and sharing their very personal story. And thank you for joining us for another episode of Health and Wellness. I'm Dr. Jennifer Ashton. Until next time, wishing you good health.